Welcome everyone, and thank you for joining the NCUI's on-demand learning session, Health Literacy, an Essential Component of Communication Strategy for Person-Centered Care. My name is Liz Best, and I'm a Manager of Technical Assistance in the Technical Assistance and Research Center, better known as TARC at NCUI. I'm also joined by my colleague, Molly Siegel, a Public Health Associate at TARC, and our Communications Associate, Sean Bitsui. This presentation was made possible by award number H723 IHS 0007-01-00 from Indian Health Service. The publication is solely the responsibility of the National Council for Urban Indian Health and does not necessarily represent the official views of the IHS or the Department of Health and Human Services. Next slide, please. For those of you that are new to NCUI, here's a little background. The National Council of Urban Indian Health, also known as NCUI, is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUI is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Health Care Improvement Act, or IHCI. NCUI strives to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible health centers. Next slide, please. Part on-demand series explores ways healthcare facilities and frontline practitioners can create a truly person-centered experience for their patients and for their communities. Health literacy affects everyone. At some point in our lives, we will all need to find, understand, and use health information and health services. And as healthcare practitioners, understanding your patient's level of health literacy should be a focus at all points of care. This webinar series will provide participants with a deep understanding of the key elements of person-centered care and why it matters as an effective strategy for fostering trust between patients, providers, and healthcare systems. This session focuses on health literacy, but we encourage you to watch our 2 additional sessions: Engaging Your Workforce to Improve Health Outcomes Through Person-Centered Care, presented by Alyssa Smith-Longy, our NCUI IPC team manager, and Navigating a Person-Centered Team Approach to Chronic Disease Management, with Vanessa Alvarez, Cynthia Gournou, and Chandine Begay, all from American Indian Health Services of Chicago. Next slide, please. This session is approximately 30 minutes in length, and we hope this session helps you build your own skills as communicators of health information. We ask that you please complete the evaluation provided at the end of our time with us, as this will help us to shape future programming. After our learner outcomes and defining health literacy are covered, Molly will share strategies and resources for improving health literacy before we share our evaluation and adjourn. So with that, let's get started. Next slide, please. During our time together, we will focus on the 3 following learning objectives. We'll understand the effects of low health literacy and how it translates into poor health outcomes. We'll spend some time developing strategies to address health literacy in patient care to improve health outcomes. And lastly, we'll learn how to assess current health education materials and develop new patient-centered education materials with culturally relevant health literacy in mind. Next slide, please. As health professionals, the term health literacy is likely not new to you, but we will start with some basics. Broadly speaking, health literacy refers to the skills a person needs to understand and make good decisions about their health. But before we can define health literacy, it is important to understand how someone acquires their health information. People receive health information through a variety of sources. Sources can include doctors, pharmacies, family, friends, the internet, and media, including social media. Finding trusted sources is important to making informed health choices. So first, health information is communicated by one or many health sources From there, it is processed until it is understood so that a person can act on the information obtained. The study of health literacy can be complicated. In the next few slides, we will further define what all this means. Next slide, please. In August of 2020, the CDC updated its definition of health literacy and included it into its Healthy Person 2030 initiative. The new definition acknowledges organizations have a responsibility to address health literacy and emphasize people's ability to use health information rather than just understand it. In other words, a patient might know what diabetes is, but do they know how to manage their diabetes and the resources available for them to continue management of care? To ensure well-informed care is provided, the organizational health literacy definition emphasizes and acknowledges health literacy is related to health equity. Thus, organizational health literacy is the degree to which organizations equitably enable individuals to find, to understand, and to use informed health decisions and actions for themselves. In other words, what are the strategies that healthcare organizations can implement to make it easier for a patient to understand health information and manage their own health? As healthcare leaders, ask yourselves, what are some of the strategies that you or your organization incorporates to achieve health literacy? So let's get back to the example of the diabetic patient. The organization at all system levels would work to make things easier for the patient to understand their disease and achieve self-efficacy in disease management. This definition recognizes that the most effective healthcare decisions are collaborative. These updated definitions incorporate a public health perspective that recognizes that health literacy does not stop at giving somebody a textbook definition and must recognize barriers to care to ensure all aspects of care are equitable and take health literacy into account. Next slide, please. One of the Healthy People 2030 goals is to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. This new definition focuses on the ability to make health information actionable. In the same manner the CDC defines health literacy, Healthy People focuses on taking the sole responsibility off of the individual. Health literacy is everybody's responsibility and should incorporate a public health systems perspective that empowers individuals to make well-informed decisions. Next slide, please. So why is health literacy important? Dr. Richard Carmana, the U.S. former Surgeon General, said it best when he said, "The poor state of health literacy in America is a crisis. It is an underlying cause of disparities. It is also a source of extensive disempowerment and perpetuates preventable disease. To ensure that healthcare is equitable, health literacy must be incumbent for all. Patient activation, better known as a patient's willingness and ability to manage their own health and care, is a strong predictor of future health outcomes. The relationship between patient activation and a patient's health literacy is difficult to distinguish from each other. Lower health literacy and patient activation are associated with worse physical health and depression, as well as anxiety related to health. Individuals with lower health literacy skills often use more healthcare services designed to treat disease complications, while fewer use services intended to prevent complications. By taking the time up front to ensure information is given and actionable, it will save money, time, and overall improve both the mental and physical health of the patient. Next slide, please. So what does having health literacy, or what does having low health literacy look like? So let's give a hypothetical example of what low health literacy might look like. John is 75. He lives outside of Oklahoma City. John has hypertension and diabetes, and he visits the clinic today to begin a new treatment for diabetes. His wife, Cora, accompanies John on the visit. John had over an hour commute this morning and has to take 3 different buses for his 10 a.m. appointment. It is now 11:30 a.m. and he has been waiting in the waiting room for over an hour, and the clinic is very busy today. The doctor comes in, he's rushed, and jumps right into discussing the new treatment plan for John's diabetes. The doctor quickly goes over the instructions for new medications, gives some details on diet and exercise, and hands John a bunch of pamphlets. The doctor asks John if he has any questions. John's wife smiles and politely nods, and she says she understands the treatment plan. John has many questions, but he's too embarrassed to ask the doctor, and he seems hurried. So he doesn't want to take up any more of the doctor's time. John nods and says he has no questions. The doctor assumes that since John has no questions, that he understands the seriousness of his diagnosis, the diet, exercise, and medication plan that John has to adhere to as well as the need for making an appointment for a follow-up lab in the next few weeks. Low health literacy may also look like a patient who misses appointments often or fails to get additional testing done. They might not pick up prescriptions or take their medication correctly. They may seem like someone who is not active or engaged in their health, when in actuality, they really would like to be. Next slide, please. So understanding health literacy. Even people who read well and are comfortable using numbers can face health literacy issues when they aren't familiar with medical terms or have health conditions that require complicated care. Nearly 9 out of 10 US adults struggle to understand and use personal and public health information when it's filled with unfamiliar or complex terms. This limited health literacy costs the US healthcare system over $25 billion a year and results in higher than necessary morbidity and mortality rates. Additionally, individuals with lower health literacy are more likely to visit an emergency room. They have more hospital stays. Like many other issues, low health literacy is more prevalent among older adults, minority populations, those who have low socioeconomic status, and those who are medically underserved. Next slide, please. Health literacy in the United States. Health literacy is key to achieving positive health outcomes. Yet in the United States, one study found that almost half of the US population have inadequate health literacy skills. Only 12% of English-speaking adults have proficient health literacy skills, and older adults, those 65 and older, have lower health literacy than younger groups. In another study done on 395 primary care patients, it was found that only 71% could read a pill bottle correctly, and only 35% could demonstrate the proper way to take their medication. Among older adults, the National Assessment of Adult Literacy found that 71% of adults older than age 60 had difficulty reading print materials. 80% had difficulty using documents such as forms or charts, while 68% had difficulty with interpreting numbers and doing basic calculations. These statistics show that low health literacy skills are more common than we might think. Next slide, please. So now looking at health literacy among American Indians and Alaska Natives. In the US, the health literacy of American Indians has received minimal attention from researchers. Yet American Indians have lower rates of educational attainment and a higher prevalence of poverty than the US all-race population, raising the likelihood that they experience limited literacy and health literacy. A small study of 18 participants published in 2019 from the University of Washington explored how American Indians who are potential research participants understand a sample consent document with the goal of explicating possible ways to improve such material while complying with current requirements. The study found that most participants felt somewhat confident filling out medical forms by themselves, but they gave mixed results in comfortability when asked questions about the consent procedures that they had read. There is a need for additional studies that relate to American Indian and Alaska Native studies on health literacy, both in urban and non-urban populations. Next slide, please. Low health literacy is disproportionately burdensome to American Indian and Alaska Natives and their elders. In October 2003, several experts and Native elders were invited to participate in a one-day seminar in Minnesota to discuss the difficulties many elders encounter in the area of health communication and to offer their recommendation for clearer health communications. These are just a couple of the comments that elders gave regarding health literacy. That doctor seemed so busy that I didn't want to take up any more of his time, stated one participant. Another elder responded, I don't want anybody to know. They'll think I'm stupid. These quotes were taken almost 20 years ago, but yet it wouldn't be surprising if we heard them still today. Researchers are collecting more data on the impacts of health literacy within American Indian and Alaska Native populations. And with that, I'll pass it on to Molly.
Thank you, Liz, so much for that first half. Next slide, please. We will now go into a few things that influence health literacy. The ones listed here are just to name a few. Literacy, health knowledge, demographics, culture, experience, stress, complexity of health condition, communication skills of workforce, how resources are designed, and socioeconomic status. In the latter half of this presentation, we will dive into these things a little bit more and give strategies and resources to ensure equitable care. Next slide, please. When trying to improve your organization's health literacy access, what your organization has first and see where it can be incorporated. This includes training and support for your workforce and the patients being served. Know your audience. Incorporate audience needs into the development and testing of oral or written educational materials. Be conscious of personal bias and prepare to meet patients and their families where they are at. Next slide, please. Low health literacy is more common than you realize. You are likely to see patients every day who have limited health literacy. Assume every patient has limited health literacy. Assess patients' health literacy. Decrease patients' anxiety with a safe and welcoming environment. Engage throughout the patient experience. If you are at the start of the patient's visit, it's already too late. Begin right when you see them. Offer help with registration forms in a private and confidential manner. Ask preferred communication method, phone, email, text, maybe a loved one. Work together with the patient in decision-making about treatment plans. Use the let's talk approach. Tell us what's going on. Ask what you can do about it. Learn where to get more information and keep healthy. Stay engaged after the patient's visit. Track and learn from patient satisfaction metrics. What can you improve on to ensure better care? Next slide, please. There's a Chinese proverb that goes, tell me, I'll forget. Show me, I may remember, but involve me and I'll understand. In essence, this is the teach back method. By asking the patient to describe what they just went over, it creates an opportunity for dialogue and helps ensure correct information is retained. In no way is this meant to test patients' knowledge, just how well the patient shared the knowledge. An example would be a provider saying, I want to make sure I clearly described you how you should take your medication every day. Can you tell me how you would describe this to your wife? The patient would then teach back the information to the provider as if he was talking to his wife. Next slide, please. From consent forms to medical instructions, curriculums to public health campaigns, our eyes are drawn to the words and images around us. The pictures you see on this slide are a few Nikui has created. The information is written in plain text, no more than at an 8th grade level, and important texts are bolded with a call to action message clear. When appropriate, some humor can be used, like in our colon cancer screening. No ifs, ands, or buts. Next slide, please. Verbal communication strategies for improving health literacy. In healthcare settings, time is always a constraint. By factoring in time upfront to build patient engagement, it will save time and money in the long run. The following 3 engagement types are not separate from each other and are only the tip of the iceberg when building patient engagement and health literacy. The first being verbal. When having any kind of verbal engagement, keep it simple. There's no need to try to impress patients by using scientific jargon. When explaining a procedure, diagnosis, or any relevant health information, explain things at the most at an 8th grade level. This is a level most adults read at. Studies have shown that 80 to 40% of medical information patients receive is forgotten immediately, and nearly half of the information retained is incorrect. Give the most important information first and explain why the information is important. Both things help patients retain the information and build trust. The tone you set up in front influences a patient's trust in taking clearly stated actions needed. By incorporating the teach-back method, a patient explains the information you provide and what they need to do next. This helps close the communication gap between clinician and patient. Next slide, please. Nonverbal engagement follows a lot of the same attributes as verbal engagement. If a patient is showing signs that they are not actively listening or seem distracted, any verbal communication will be lost. Address issues that might be causing this behavior. Sometimes a different person is needed to address any issues before continuing care. Keep any visuals easy to understand. Physical flyers or documents the patient can go home with help serve as reminders and prevent inaccurate information. Smile and build rapport, show interest in patients' questions. Make sure the room is private and comfortable. Use easy to understand visuals. Look for active listening. And sitting down instead of standing up can provide a more comfortable environment if you have that option. Next slide, please. Culturally relevant engagement ensures the patient receives care that incorporates their own background. Having materials in multiple languages ensures everyone can read the same materials. The terminology used should be culturally relevant. Some natives refer to diabetes as sugar sickness, and depending on tribe or region, refer to things differently. Think soda, pop, whatever it might be called in your area. The graphic shown on the slide comes from the 2020-2021 NCUA Youth Council cohort. The Indigenous Medicine campaign puts culture at the forefront of what healthy relationships look like by using culturally sensitive terminology and graphics to bring the message home. Be mindful, educated, and respectful of the population you are serving's beliefs and help build trust to address any medical issues. At certain genders allowed to do something or maybe not to do something? Is there an age at which they are expected to take on certain responsibilities? Asking questions and doing some cultural homework will help provide the best care possible. Next slide, please. This is a list of a few resources we have compiled you can view for your own use. All of the ones shown here are free, and a few come with continuing education credits. In 2019, the Indian Health Services provided 15-minute introduction to health literacy training videos that can be shared. The National Action Plan to Improve Health Literacy contains 7 goals and strategies that will help improve health literacy. These strategies include building partnerships to disseminate accurate health and safety information. The Plain Writing Act of 2010 requires federal agencies to write clear government communication that the public can understand and use. The Act provides training classes for federal agencies and a plethora of public resources. The CDC offers 3 online health literacy courses and for health professionals, and is currently updating another 4 more. The website also offers a toolkit and presentation notes that can help with any health literacy skills building needs. There is the CDC Clear Communication Index, and the CDC also features other reputable health literacy and related trainings and materials from other sources. The costs are free, and once more, some come with continuing education credits. So I encourage you to check out the resources more. Next slide, please. This is a list of references used for this presentation. Without these references, today's presentation would not have been possible. Next slide, please. We appreciate any feedback you would like to provide about your session experience. Please scan the QR code shown on the slide or type in the link. The evaluation link can be found on the series registration page and via email. The feedback you provided helps inform new projects and additional work at NCUE. Next slide, please. Thank you so much for listening to Health Literacy Intersessional Component of Communication Strategy for Patient-Centered Care. We hope you enjoyed our on-demand session. Please take a look at our other 2 on-demand sessions of Communicative Learning series focused on patient-centered care, engaging your workforce to improve health outcomes through person-centered care, and navigating a person-centered team approach to chronic disease management. Thank you for your time.